mynews.studio.
Today, two countries thousands of miles apart have wiped out the world's leading infectious cause of blindness. So what does it actually take to erase a disease?
That's not a headline you see very often. Today's date is 2025-07-18. The World Health Organization has just declared Senegal and Brunei free of trachoma as a public health problem. Just to clarify, trachoma is the infection that's caused blindness for millions over centuries. What helped these countries reach this milestone?
At the core, it comes down to public health basics: water, sanitation, and antibiotics. But for both countries, it wasn't just a standard formula. Senegal, for example, relied a lot on mass antibiotic distribution, azithromycin specifically, and ran big campaigns about facial cleanliness. They also invested in water and sanitation infrastructure, especially out in rural areas where trachoma still lingered.
So, it's not just about giving out medicine. Infrastructure really mattered too, right? Things like clean water and better toilets. That sounds fundamental, but scaling that must be tough.
Exactly. And for Senegal, these efforts were all tied into broader eye health and neglected tropical disease programs. They mapped out where trachoma was most severe, maintained surveillance, and brought local health workers and leaders on board. Honestly, without that local engagement, just distributing antibiotics wouldn't have been enough.
How about Brunei? Their approach seems less talked about.
Brunei's situation is a bit different. Because it's a high-income urban country, they already had solid sanitation in place. So, their focus was likely on rapid detection, making sure advanced cases got surgery quickly, and using antibiotics in a targeted way. With a centralized health system, monitoring and fast response were easier to coordinate.
So Senegal needed broad campaigns and new infrastructure, while Brunei could use systems already in place. But both had to make it a government priority. Is that fair to say?
That's right. Ongoing government commitment was essential. In Senegal, national leaders kept trachoma on their agenda, even as case numbers dropped. They invested in training health workers and made sure the message reached schools and villages.
So it's not just about policies at the top. Community engagement played a big role too. How did they keep people involved over such a long period?
Local leadership made a huge difference. Community health workers, volunteers, and respected leaders helped adapt messages to local languages and customs. They ran awareness campaigns, sometimes literally going door to door, to explain why facial cleanliness and antibiotics mattered. That trust building was crucial.
For countries still struggling with trachoma, what's the hardest part now? Is funding the biggest roadblock, or is it infrastructure, or something else?
It's a combination. Funding is always difficult. International donors help a lot. They provide flexible funding, technical support, and make medicines available. But countries also need help with mapping the disease, tracking cases, and making sure these programs fit with other health efforts.
So it's not just about stopping trachoma right now. It's about making sure it doesn't come back. Surveillance has to keep going, even after the headlines are gone.
Exactly. Countries have to continue surveillance and maintain their infrastructure. If efforts slow down, trachoma can return. That's why building capacity and keeping up investment really matters.
The bigger takeaway here is that this isn't only about trachoma. It feels like a template for tackling other neglected diseases.
That's right. Senegal and Brunei show that targeted health interventions, international support, and community involvement can make a real difference. If it worked for trachoma, it raises the question, why not use the same approach for other diseases?
So the lesson is, invest in basics like clean water, give local communities real power, and keep the pressure on. It sounds straightforward, but putting it into practice is the real challenge.
And it shows that global health victories are possible with the right strategy and commitment. If others follow this model, millions more could benefit.
That brings us to the end, a story about hope, with trachoma eliminated in 2 countries and a roadmap for more. Thanks for staying with us.
Thank you for listening. This episode was brought to you by mynews.studio. Try it for free.